here's the thing with this section. You need to know how to apply the information that you already know. With these sections, when a question is asked of you, being able to decipher what that question is asking, and then from that space of being able to decipher what the question is asking, being able to choose the best answer. Here's where we suggest that you begin really looking at some of those practice tests. There's some different sites and things like that that have practice tests, so you can begin to see different questions and how they're asked. Also, here's where Rosenthal will come in handy. Rosenthal asks his questions throughout his book, and it lines up with all of those eight K-CREP domains. So when you look at how Rosenthal asks those questions, again, it's how you respond to those questions, how you are looking. Like she mentioned the geriatric patient, or client, you're looking at what things do you need to know about a geriatric population or whatever the case is. So when you're asking that question, you can now frame it in that way. Same thing for if they talk about career development, or if they talk about groups, like how will you frame it? What information do you have that will help you to frame a correct answer?
So one of the things that they're concerned is that you know how to be in a clinical environment. Absolutely. From these different issues that could particularly show up. How do you know how to be, how to act, what your next step is once a client shows up with these presenting issues?
Absolutely. And so what we did was, Dr. James talked about that list that you'll see in your handout in your oh my goodness, that you'll see in the downloads from the NBCC. And in that, you'll see how they broke down the questions, and you'll see that we took the questions and how they broke them down, we honed them in, and we gave you those bullet points. Well, so now what we've done for you is now categorize them to help you organize your studies a little bit better. So what would be a great idea for you at this time is to make sure that you look at each of those PowerPoints and make sure that you understand something about each of them. Here's what I mean. So if one of the PowerPoints talks about, let's talk about behavioral. If one of the bullets for the behavioral interactions is racism, discrimination, oppression, and also, so if it's racism, discrimination, and oppression. So what you need to understand is from the cultural perspective. So you want to make sure that as we talk about those 8 K-CREP domains, because what we're trying to do is bring those together for you, you make sure that you look at that social and cultural perspective in the K-CREP domain, the diversity piece. You want to make sure that you understand how those things play out so that you will be able to answer a question if there's a question that is based on an issue of racism or discrimination as far as a client is concerned. Where does that fit? Where does it fit ethically, right? So making sure that you understand, that you have a good understanding, a working knowledge of each of those bullet points is going to be very beneficial and key in helping you answer those questions on that exam.
Yeah, absolutely.
And so, additionally, want to make sure that you understand the helping relationship piece. That is also one of the 8 K-CREP domains that NBCC has set forward. You will definitely see tons of questions that have to deal with the helping relationship. And it is one of the ones that is, and I will give you the exact breakdown of numbers here for... Okay, it's not moving. I'm going to give you the exact breakdown of numbers for the K-CREP domain. And am I? Is it going to happen? It may not happen. But it is definitely one of the 8 K-CREP domains, the helping relationship. And so it's one of the major pieces that you want to make sure that you have that information on. And so one of the things that I want to touch on for you in that is understanding this concept of solar, right? And having that understanding. So solar is an acronym that is used to summarize the attending behavior that is desirable for the counseling relationship. And if you're able to focus, if you're able to answer those questions that they ask from the solar perspective, one of the things that you'll be able to do is, again, sort out and use that deductive reasoning to figure out what is the best answer. Because oftentimes what they're asking you on the NCE exam is what is the best answer. So I'm going to go through the stages of solar really quickly. And then we'll make sure, well, I think you have the information on that. And even if you don't, it's really easy for you to look up. But the solar piece is making sure that solar is facing the client squarely. That's the S in solar. So making sure that you're right head on with your client. O is an open posture. So making sure that you maintain an open posture and you have that inviting posture. Leaning forward is L. So, and that is just to make sure that
what's happening.
that as you are engaging your client knows that you are engaged. E, making sure that you have good contact. And R is staying relaxed, right? So making sure, because when you're in a good place, your client can be in a good place. And I think for me, that is one of the key places to key places to park, especially when we talk about helping relationships and all of those things that you all need to know when it's talking about these areas of clinical focus, because it is talking about how, like Dr. James said, it's talking about how you are with your client, how you're with your client. And this solar acronym, SOLER, gives you a great framework on how to be with your clients.
Right. So it gives you a framework. You also have to put solar into a cultural context. So for the S that talks about squarely facing your client, well, you may not do that if you're dealing with a particular community where the direct, eye-to-eye contact is disrespectful for whatever reason, whatever the different, maybe is different age groups or different social levels. It may be disrespectful or not, allowed or common practice in that particular culture. Same thing for eye contact and for the resting, the relaxed posture. So you want to know that you're culturally specific. So how you're with your client, we honor them when we understand their cultural background, their cultural ways of being. Now, what this does not mean is you do not become someone else. You remain your authentic self, but we respect their cultural ways of being. So while you engage solar squarely, it's all about body posture. Solar is about body posture and how you are presenting yourself within the context of the therapeutic encounter. But each one of those, the leaning in, the eye contact, the relaxing, the openness, as well as the square posture, needs to be taken within and addressed within the cultural context.
So where we'll go from here is basically, again, making sure that you have all of the information that you need as far as helping to guide your studies this week. As you have already started to look at clinical focus, also you want to make sure that you are taking some time with these bullet points. My suggestion for this week is to take each of the bullet points, and yes, it's quite a few of them, but making sure or assessing where you are and what it is that you know about those bullet points, so that you can make a judgment call as to what more information you need to take in.
What additional studying you might need to do. So, for instance, go to the PowerPoint, and particularly you'll go through the narrative, but particularly the PowerPoint, which I think all of them do except one. All of them have a list of terms, phrases at the end of that section of PowerPoints. And each bullet, like Joyce said, each bullet, just sit with it. If you go to it and you say, okay, I know what I need to consider based upon this bullet point. If you can readily pull that, then you're good. Go to the next one. Yep, I know what factors I need to consider if this is what shows up in my counseling environment. And you do that until you hit one, you're like, what is that? Now, what do I need to consider? That's where you need to go do some more investigative work.
All right. So we are done with this, and we want to make sure that you have everything that you need. Be sure to check out those
the handouts.
Handouts.
In the link that's referencing NCE documentation or handouts. Make sure you go there. So we've downloaded some additional information there for you.
Yep, come straight from the NBCC website for you. All righty.